All right, Guru Nation. So I'm gonna do a quick video for you guys on a CRA's day and what that involves. And a CRA has really two different types of days. They're either traveling slash on site, meaning monitoring a site, or they are uh monitoring at home, so not on site. Usually they work at home. And I'm just gonna go with on site because that's the most action, really. I mean, when they're at home, they're usually doing queries, issuing queries, straightening out things with the trial master file, which are the regulatory documents. But when they're on site, that's where the action is. And I've been, for those that are wondering, who the hell is this guy? I thought he's a site owner. Yeah, primarily a site owner, but I've actually been a CRA and I had a 3 to 5 year stint as a contract CRA for numerous companies. So not just talking from theory, I've actually done this a few times, quite a few times, and for a few years at different sites, academic medical centers, small sites. I've done audits. So there's a lot that goes on. There's a lot of unseen challenges when you're on site. And that's the nitty-gritty of and the reality, I guess, of a CRA. Like for some reason, this job got so glamorized and so romanticized. Like there was these TikTokers showing how they're traveling and the hotels they stay. When you are a CRA, all right, you're lucky to like see your hotel, like just to sleep. That's really what you're there for because you're on site. And even if you get to the hotel early, I mean, some CRAs work on the airplane. I've done reports on the airplane at the airport for sure. I generally don't like to work on the airplane, so I'd like to finish it either on, ideally I want to finish my report when I'm on site, but I could always put the finishing touches at the airport. And then you're really busy if you're doing this on the plane. And I know some monitors, even when they land, they go home, they're doing it. So there's a lot of unanticipated and some anticipated issues that series go through on a daily basis. It is not glamorous, right? And there's unexpected curveballs all the freaking time that don't appear in training manuals. When I was an unexpected curveball I had was, hey, I show up and oh, we forgot you're actually coming. Sorry, we're not ready. This was at a big academic medical center. We're not ready. Can you come back? No, no, I'm already here. I'm not going back. I flew here to get here, so I need to do some monitoring. I need to see the regulatory person or the backup, and I know the coordinator is not here because I was told they were not there. The backup or the project manager, just somebody's got to accommodate me, give me the binders at least, let me do it. This was before really the prevalence of like eSource and eReg. They did have a regulatory system called the Red Cap that a lot probably still use. So I knew I could get access to that. I knew I can do at least regulatory, at least investigation of product accountability because the pharmacist was there. And then I knew I can do source data verification. Just someone had to bring me the books. That's it. I just need someone to bring me the books. And so they let me in. So that was like a newer CRA might be intimidated and want to go home. Well, okay, well, I guess I got to reschedule. You know, no, you don't do that. You're there. There's no way you showed up and you're not going to be monitoring. So anticipate problems like this. I've also been made to wait in waiting rooms for like an hour or longer. Same academic medical center because nobody came down to get me. Either they were very busy or they were preparing for what they didn't finish before they give it to me. So just be ready for like curveballs. Now, there are like clues of what's like a good site and what's a bad site. What site you're gonna have to spend more time at, and what site is gonna be pretty good. So I went to a site for my routine first IMV. So I did the SIV at that site. I was the one that did the site initiation visit at that site. And then I went after they screened their first patient. I had to be there within 2 weeks prior to them randomizing. So I went to the site, and the first thing I say, hey, I want to sign the monitoring log, bring me the investigator site file. And they brought me an investigative site file. When I opened it, the cover had the right protocol on it, but when I opened it, it had it had some of my protocol and then some of a different protocol, and there was just stuff just all over the place. Now, that's actually like a really big finding. If I were an asshole, I would definitely bring that up. Like I could make a big deal out of it. But instead, and this is just the way I prefer to work, not that I'm like necessarily a cool dude. I am pretty cool, but that's a different story. I brought the coordinator and I said, listen, this is actually a serious issue. Like if I were an auditor, I would now be looking through all your binders because this is confidentiality for sponsors. So I'm wondering what you're doing when it comes to confidentiality with sites. And she said, oh, I'm sorry, I don't know what happened. And she took it back and brought back the right one with all the stuff in it. It was missing a bunch of stuff. It was missing a lot of the essential documents that I know I did at the SAV, and I scanned them because that's what I was supposed to do as a monitor to have proof that I have the Adobe scan on my phone, to have proof that I did these. So I told the coordinator, no, look, I was here. I did it. I have copies. But we don't want the copies. You need to have the originals on site. I knew from my first monitoring visit that was going to be a difficult site. And yes, they were. They were very pleasant people to work with. They were just difficult. Action items never addressed, despite repeated monitoring visits. Wrong consent forms being used. Luckily, they didn't have any investigational product, uh, real big safety issues, but they had tons of IP admin issues. Like they would put a different amount of pills returned for each bottle than was actually in there when I counted it. So it was just a nightmare. I didn't plan on, and I got paid the same for going to this site, which gave me a lot of headaches, versus going to another site where they were high rollers, but they they got their stuff together. And I actually still talk to that coordinator on Instagram occasionally. She moved on, I think, to med school. But that coordinator was great, and you can tell the difference between like this med school student and this revolving door of coordinators who nobody was able to do anything at the AMC to this other problem site. So I knew right away, and I got paid the same rates to go to both, which one was going to give me the headache, which not. So I prepared in advance, and I knew for the site that required more work, the day prior to my monitoring visit, I would email them and say, "Hey, I'm coming in tomorrow. You guys need to have, this is what I'm going through. You need to have these action items." I would CC the PI. It was tough. And then you've got the drama on site when you're navigating the uncharted territories, right? I've gone to big AMCs where they just kind of stick you in a room. My first monitoring visit at this academic medical center, they stuck me in a room with three other monitors from other studies. And we're all just sitting there in our little cubicles, not supposed to talk to each other. But of course we do. And one of them said, "Hey, you're on the YouTubes. I watch your stuff." And then the other one said, "Oh, wow, what do you do?" So she was like asking me questions. And then, I mean, it was great to see like a viewer and then somebody else who didn't know me, like I can get a new subscriber. But it was so distracting. Like I was really there to monitor. And so I had to like balance getting my work done with talking to these two people who were now very talkative. And there was a third CRA in there that just was listening to everything but didn't say a word. That was weird. So I told my coordinator I didn't want to be rude and do it during that visit. So I did it at another visit. I said, listen, prior to when I'm coming, I don't care what you do, just please let me have my own room. And they started honoring that after I asked. So they had to just schedule accordingly. Because I'm not, listen, I am a very social person, so I love to be around other people, But if I'm monitoring, I cannot do that because then I'm not doing my job and I'm just never going to finish. So I know my own limitations. You're going to have issues like that. At another site that I monitored, I ran into a former monitor at one of my sites and she was a witch with a B. This lady was, she gave everyone problems. She made one of my coordinators cry. And then they tried to put me in a similar situation, like in a cubicle. This was another site with this person, and I had to like, I noticed it and I stopped and I went to the coordinator. I said, listen, you can't put me in there. I'll go in your break room. I don't care. Just I can't be in there. It's gonna be very awkward. And she did. So that's like navigating the unexpected, like uncharted territory. It's not your office, so you can't really do, whatever you want. Um, you have to know how now when it comes to doing your work, you have to know how to ask the right questions, uncover the hidden issues. The best people to do this are the research assistants, if you can ever get them in and just kind of probe them like, hey, how do you guys do investigational product? And then they'll tell you because they're less, I guess, familiar or less knowledgeable of what they're not supposed to say. So then you get things about uncalibration law, like calibrate equipment that hasn't been calibrated, temp logs that, nobody really knows. They just kind of check it here and there. You can figure things out pretty quickly. And then it leads into how are you going to mitigate things from happening in the future? Unfortunately, you need cooperation from the sites too. And I told you guys at my problem site, they never got their act together. They didn't have too many huge issues, but it was just an admin nightmare as a monitor. They did have deviations, and like even consent deviations, but they didn't like dose a patient with the wrong drug or something crazy like that. I had one situation where a site was doing a study where it was allogenic. The patient's own cells had to be reinfused back into them after getting mixed with some IP. So it's not allogenic, meaning one for many. It was autologous, which means from you to you after it was mixed with some investigational product. That never, they actually dosed the wrong patient with someone else's drug. This is autologous. So from that person's cells went into another person. Miraculously, nothing happened. But that could be like anaphylactic shock. That could be a life or death situation. So always be ready for the curveballs. And then future proof not just your site, but your career. So I use that training log probably every single time I went to that problem site. I had them do Kappa plans. I had them do everything. I threw everything I had at them. They never changed. The other site, I would do training log, maybe a Kappa plan here. They got their act together. And so you have to figure out, like sometimes there's nothing you can do. But as far as future-proofing your career, always be pleasant with people. You never know when you're going to run into someone else again. This is a big industry, but a small industry in that regard. You don't want my experience with that CRA I mentioned, who was a witch with a B, uh, to be about you. And so you really got to pay attention to your social skills and be professional. Being friendly does not hurt either, even if it's not part of your nature, because you're future-proofing your career that way. And the more pleasant the CRA is to work with, people like the PIs and coordinators like them. And this is, again, small but big industry. Hopefully, you got some tidbits out of this. Like, subscribe, comment, share. I'll catch you later. Bye bye.